Hey guys, Michael Hopper here. Today we're going over a simple way to address stiffness in your upper back. Now, a lot of us have a tendency to spend most of our day in a seated position, whether that's for work, whether that's when we're watching Netflix. Regardless, recognize that if we spend most of our time in a seated position, that tends to wreak havoc on our body's joint and tissue health. It places a lot of stress there, and it can lead to a lot of compensations down the road, which sometimes can lead to pain and injury. So when you think of being in a seated position, one area in particular, I've got a chair here behind me, I'll show you in just a moment, but one area in particular that gets really stiff is called your thoracic spine. Generally what you think of is your upper back. So the area that I'm rounding from, that's my thoracic spine, or that upper back area. Now what tends to happen, if that gets stiff or tight, it tends to place a lot more stress on our neck, on our lower back, on our shoulders. So in other words, it can have far-reaching consequences. So it's a very important area to make sure that you're moving really well from. So when we're in a seated position, if we have a tendency to be rounded because we're interacting with what's in front of us, in order to really counteract those effects, we want to do as much as we can in the opposite direction. So we want to do thoracic extension. And we can do that sitting in a chair. So I'm going to show you from the side so you can more easily identify the angle or the direction that we're going. So what it looks like, you can pick any kind of chair. Ideally, you want to have at least some opening in the area between your shoulder blades so you can move freely in that area. So if it's a super tall chair, you might want to modify. What tends to happen when people try this is they think they're doing the movement, but it's all coming from their lower back. To help counteract that, you want to cross one leg over. This kind of keeps your lower back locked in. It's not going to have a tendency to help out as much. And then the position itself, I'm going to clasp my hands together, just resting on my neck, not pulling down on it. Elbows are going to be close together. And then the thoracic extension part is just kind of like a scooping motion. So with my elbows, I'm going to almost draw a reverse C shape and come back to the start. So I'm pointing my elbows up toward the ceiling and back to the start. The area that you want to feel that in, the primary area, is between your shoulder blades. If you feel it in your neck or your lower back, you're doing something wrong. Sometimes it can mean don't go as far. It could also mean check your lower back position, whether you need to be leaning forward just a little bit more. If you have a tendency to overarch from your back, you can make little tweaks there. But it should be a very subtle motion. That's normal. But you want to spend at least a couple minutes on that. So I'll tell my clients, hey, if you're spending most of your time in sitting, every 30 minutes of sitting, try to do some kind of 3, maybe even a 5-minute movement break. And it could be, if you're switching tasks or after that 30-minute mark, spend a couple minutes working on your thoracic spine. So that's one version. The second version is you can go up, and then once you kind of reach your end point where you can't go any farther without using your lower back, you can go here and slightly rotate to one side. So it's up, slightly rotate to one side, and back. All right, guys. So that's that seated thoracic extension. Give that one a try. A lot of us can benefit from just practicing that several times a day. If you'd like to learn more about how I work with athletes, reach out to RestoreThrive.com or give us a call at 913-396-9726.